I'm Maida Galvis. I'm a pediatrician here at Mount Sinai. I have been a Sinai for many years now, for 16 years. Started as a fellow in environmental pediatrics back in 2002, and I just had the honor of working with a really terrific team at Mount Sinai, and the team that put today together, honestly. And they're all here. So if all the folks who have been on our Sinai team, can you all just stand up for some recognition for helping us celebrate the first Children's Environmental Health Day in New York State. Michael, Luz, Allison, Hannah, Dorothy, Carrie, Kathy, Maricela, and Lauren. Just such a terrific team. And it truly is a party. And so I had the honor of meeting with Assemblymember Gottfried with our former chair and mentor, Phil Landrigan, who really had the vision for the state-based network of children's environmental health centers across New York. Right before Phil Landrigan left for his new post up in Boston, and we said we would love to have a formal declaration of Children's Environmental Health Day in New York. And Assemblymember Gottfried said, of course. Let's do this. And it was kind of amazing. And I can't tell you how thrilled we were to get this document. And it's a piece of paper, but it means so much to us. And I was reading it yesterday as just a reminder of what we're celebrating today. And I thought, how great would it be to read some of it to you? But you don't want me to sit here and read all of this. So we thought it would be better if you would hear from a truly special messenger. Ryan Suseno. And so here he is, reading from the proclamation.
3. The aim of Children's Environmental Health Day is to raise awareness about the importance of clean air and water, safely consume water, and healthy environments to children's health and development.
Ryan is Carrie Sheffield's son. And he made that video with his parents last night for us. And that's a powerful example of how every voice matters, and children's voices in particular. And so if you could share the word about Children's Environmental Health Day today with your social networks and the people that are important to you, feel free to use the hashtag from Children's Environmental Health Network, an environmental nonprofit based in DC. And they really started this national movement and got us started. So hashtag CEH Day will link you to the activities that are happening across the country and to other states that are also celebrating today. And if you want a link to our network, at NYS CEHC is the New York State Children's Environmental Health Centers. The Twitter handle that Michael Agiogu, he's actually actively tweeting today, so feel free to reshare his tweets. And so every voice matters, and one of the things that's been a unique privilege over the past 10 years is walking the walk with people who take time out of their incredibly busy schedules to meet with key decision makers and tell them the stories of the families that they're hearing from on a daily basis with concerns about environmental exposures, whether it's in their homes, their schools, or communities. And so here we are up in Albany with Commissioner Zucker, who's in the pink tie in the center, and two visionaries in the field of environmental health, Phil Landrigan and Rob Amler. Rob Amler essentially started the National PACE program back in 1999, which you'll hear about from Perry Sheffield. And Phil Landrigan had the vision for the state-based network that you'll be hearing about. And there they are with some leaders in the field and the next generation. So something they thought was really important was training folks who would be the next generation of leaders. And that's something that's really important to us as well. And so those folks would go around and tell the stories of the families that they're seeing every day. Families dealing with chronic conditions like asthma, substandard housing, mold in schools, and contamination from illegal dumping on Long Island, for example. And so these are things that are happening not only across New York State, but in the country as well. And what's amazing about New York State is that when we meet with key decision makers, they get it. They just get it. And so these are folks who across New York have said, we need children's environmental health services for all families in New York. And so we really want to honor these folks who have supported the Children's Environmental Health Centers of Excellence over the past decade. And what it's led to is this. So the PACEO at Mount Sinai was funded through CDC and EPA and has a sliver of funding. We were a team of about 1.5 people. And it's now this network, a powerful network that's a coordinated voice for children in the environment. And so we're really thrilled to be part of this amazing community. And these centers are located across New York in Albany, Buffalo, Syracuse, Rochester, Westchester, Long Island, and New York City, located at children's centers. And so people can go to local experts for advice on what to do about environmental exposures, where children live, learn, eat, sleep, and play. And this is it really takes a village to accomplish this. So this has been a labor of love for many, many folks over many, many years. And so we wanted to acknowledge all the folks that have supported this work for so long. And so our core areas of work include establishing a pediatric environmental health clinic that Dr. Lauren Zajac is directing, fielding questions from healthcare professionals, and Dr. Perry Sheffield is going to tell you about that, as well as training the next generation, informing program and policy changes, and community outreach and education. So I'm going to turn it over to Dr. Zajac to talk about the Pediatric Environmental Health Clinic.
Hi, good morning, everyone. So I'm Lauren Zajac, and actually like Maida and Perry Sheffield, I too went through the Environmental Health Fellowship Training Program at Mount Sinai, and I've been fortunate enough to stay on its faculty and as a member of this great team. And one of our exciting new initiatives to really better serve the needs of children across New York State is to open a pediatric environmental health clinic where our interdisciplinary team of experts provides services for patients and families on the diagnosis, management, and importantly, the prevention of environmental exposures. And to be forward-thinking, we're really deliberately trying to figure out how can we meet the needs of children at highest risk and children who may not have access to the traditional clinical services. And so under the direction of Dr. Erin Thanik, she's a pediatric allergist and a preventive medicine physician and a member of our team, we're opening a co-located environmental asthma clinic with the Department of Pulmonology here at Mount Sinai. And we're really excited about being able to provide comprehensive screening for environmental triggers of asthma and referrals to community-based resources. In addition, we are launching an EPIC telemedicine component to our clinical services for families who are unable to come to a clinical visit in person. So I'm just very excited about these new opportunities at Mount Sinai, and it makes coming to work every day so enjoyable. And the clinic is one arm of a sustainable approach that the New York State Network is taking to really integrate children's environmental health services into existing structures to make them more accessible and, importantly, sustainable into the future. And so really the middle kind of holding up all this work is the Pediatric Environmental Health Specialty Unit, which has provided us the initial scaffolding to grow. And then, of course, our newly launched statewide network. But I just wanted to highlight for you guys some of the exciting things that the New York State Network is working on. And so the first is, one of our priorities is integrating environmental health screening into primary care, subspecialty care like pediatric pulmonology, and also through community partners as a quick way to identify key environmental health issues that families are facing and be able to provide real-time referrals to existing community partners and community-based resources. So for example, we're currently working with NYS and Little Sisters of the Assumption, who offer home-based environmental asthma trigger reduction. And the families that have been referred have such wonderful things to say. So the next piece of it is integrating pediatric environmental health into existing medical systems, specifically the electronic medical record. And so being able to not only see patients in the clinical setting, but making environmental health tools available for primary care providers. So they will have access to information, referral sources, and resources for patients in real time. To make our services more sustainable, we are working on initiatives with healthcare payers, so Health First, the district program, private insurers, to get reimbursement for these evidence-based home visiting services to take care of environmental asthma triggers, for example. And then finally, which Perry Sheffield will discuss, is to be able to reach the most children in New York State possible, we have to reach all the frontline providers, so all the pediatricians and nurse practitioners and physician's assistants. And to do so, we are launching a Project ECHO, which Perry will describe, in order to provide the guidance to all of these frontline providers of how to diagnose, treat, and manage environmental exposures.
Good morning, I'm Perry Sheffield. I co-direct the statewide center network and a deputy director of the PACU network. So for those of you who are new, there are many old friends in the audience, but for those of you who are new, for, as Maida mentioned, 20 years there has been a national network of pediatric environmental health specialty units. This is a screenshot from the website. And it serves as a resource, a national available resource for the public or for health professionals to seek information. And it's divided by the 10 EPA regions. And so as you see, us in New York, we are region 2 for New York, New Jersey, Puerto Rico, and the Virgin Islands. One of the effects of having 20 years of continuous programming around this is that it has built a network. We have friends around the country, and the depth of knowledge at each of these centers is great because there has been enough time to build that. And so, but as you see, we aren't even the largest geographic region, and we all have these challenges of reaching the remote areas. And so we are thrilled to be able to dive deeper here in New York State, build a network around New York State, equivalent but now with deeper reach locally. And as has been mentioned, we're using a platform called Project ECHO, which is a web-based platform, as you see it in action here with one of our summer students who was with us, helping navigate the telementoring session that was happening. And we are starting with building capacity at the centers, as you saw those photos from around the state. And then from there, growing additional spokes, as they're called, out into communities and harder to reach places, because we can't be everywhere at once as much as we still can sometimes think we can. And so that's the ECHO model, and it's being used in many places. We're replicating something that has already been used on a national level in New York State and beyond. And we're also thrilled to introduce our first inaugural class of environmental health scholars. We're joined by one of them today, Amy Brown, who's at our Mid-Hudson centers, Sandra G, who's in Rochester, and Hennessy Sabro, who's at WEACT here in New York City. And so we're thrilled to have a mixture of community organizers and doctors involved to really help elevate and, as Maida said, train the next generation as well. And so that brings us to the most exciting part of our program today. Children and the environment need heroes, and this room is full of them. And some of them are getting awards today. And also, some of those heroes are presenting those awards. And I have the pleasure of introducing the first award presenter, Deb Nagan, who for a long time was at the City Department of Health, has been an incredible champion for children's environmental health. And now we're thrilled that she's working with us to help get us organized and bring that wealth of knowledge that she has from her years with the city to think about the state network and how to most effectively implement that. So I welcome Deb.
Good morning. So let me say that it's such an honor to be able to be up here and introduce a colleague who I love. So I thank everybody for the Sinai folks and the network for asking me to do this. So I'm here to introduce Dr. Mark Mataloni. Mark is a toxicologist, and for those of you who don't know what that is, these are scientists who study the adverse health effects of chemicals on living organisms. Now, Mark could have chosen to work in a lab, and he could have chosen even to work for business, but he didn't. Mark is a people person, and he is a scientist who really wanted to use his knowledge to make the world a better place for people. In 1991, we were lucky enough to have Mark to come to EPA to be their regional risk communicator. A couple of days ago, I called him, and on a street corner, I'm taking all this down, I said, Mark, you've got to pick what's your biggest accomplishment? And that's actually a hard thing when you've been almost 28 years, 27 years at an organization. To pick your biggest accomplishment, no easy thing. And I think the two things that came to mind were, one, the incredible work that went on after the World Trade Center explosion. That was an incredible time for us in New York. It was a time of confusion about what to do, and it really took all these scientific minds coming together, and not only scientific minds, people, the community, to come together to figure out what to do. So I think one of the things that he pointed out was to try to basically identify the contaminants and come up with, I'll do this, with protocols for cleaning people's apartments. No easy, it sounds easy, but actually it was a really challenging thing and made a big difference to New Yorkers who that explosion really came into their homes and they were disrupted for many years. The second big accomplishment was really related to children's environmental health. And for two, I would say, pinch hitting times, he pinch hitted for, not be a word, for both Maureen O'Neill and then later Becky O'Frain, who were the children's environmental health coordinators. So Mark really has been a friend to really support all the work that we've done, or that Sinai and others have done in the community related to children's environmental health, and for that we thank him on behalf of those. And I thank him for the health department because he's been a friend. Now, what are the challenges? And this is something that actually I can relate to much, because as Perry said, for 18, actually it's longer than that, almost 30 years, I was a bureaucrat. I worked in government. And one of the biggest challenges of that is not to be a bureaucrat. To try to figure out a way that you can help people, be transparent, and really make a difference. And Mark really has made a difference and really tried not to be bureaucratic and not open, and we really thank him for all of that work. So for that, he gets, as Maida would say, she describes them as environmental rock stars. So with that, Mark Mataloni.
Plus, he loves Thai food.
I do. I'll have to get over to Thai in the park soon.
Well, thank you for that very generous introduction, Deb. And in keeping with the rock star theme here, if I could just digress, when Bruce Springsteen was inducted into the Rock and Roll Hall of Fame. He was introduced by Bono, who has a way with words, and which prompted Springsteen to comment, because always get introduced by an Irishman. But apparently, the boss is never introduced by you. So thank you for that nice introduction. Many of you at the PESU have heard this before, but it's worth repeating. I worship the ground you walk on. And it's for good reason. Your commitment, integrity, and smarts in advancing the cause of children's environmental health is extraordinary. So receiving an award this award is in itself a great honor, but coming from this group is really special. So thank you. Now, as Deb mentioned, I spent 28 years at an agency that I called home, and at times I hardly recognize that agency now, from retrenchments in the mercury emissions rule to inaction on pyrophos. There seems to be a shortage of national leadership on environmental health issues, and that makes the work that we're doing here like all the more important from a grassroots, ground up basis. So I'll just say that to everyone in this room, let's keep up the good work, and thank you for the award. Swag too.
Hi everybody, I'm Kathy Collins. I'm the director of the Long Island Centers. And it's my pleasure to introduce the next person who's going to introduce somebody. So one of the core values that we're trying to espouse in developing this fledgling network is to make sure we involve the community. Now, of course, we can't directly involve every single person who we'd like to, but we have a good way of trying to reach as many people as possible by making sure that we utilize the strengths of our community partners. So we're trying to exemplify that value in Long Island by using a very, very strong community partner with very, very strong leadership in the form of the Huntington Breast Cancer Action Coalition, especially its founder, Karen Miller. So I'm very pleased to present Karen Miller, who's going to talk about the values of the next people. Come on up here. Oh, and I was also asked, can we have like a shot of the logo by itself?
No, that's fine.
Just there?
Forward.
Forward?
Just stop there, that's good.
Okay.
Oh.
Okay. So one of the things that we tried to do in creating our logo, first of all, we wanted to make sure it was impactful and memorable as an icon. But we also wanted to say something, right? It's nice if there's a story behind the image. It's not always obvious, but the impetus behind it is the idea that the blue big triangle in the center is an abstract of the state of New York. Perhaps the words New York State represent the tail of Long Island coming off of that. But really it's about the supporting structures around the state. And as we've color-coded it here, children and environment and health. So all of those things working together to point the way forward so we can make progress in solving the problems at hand affecting children and families. So Karen, please come on up and introduce the next folks who are,
Thank you, Kathy.
we're so proud to honor today.
Thank you. You know what?
we are a family. Look around, and you can actually, I think the room, it's palpable. This is the real deal. You're hearing so many people, and you're about to hear more people who are the movers and shakers that make such a big difference. I'm so proud to be a part of this team. So all of the awardees represent many wonderful recognized organizations, because each of these outstanding individuals understood, Aristotle says, excellence is never an accident. It is always the result of high intention, sincere effort, and intelligent execution. It represents the wise choices of many alternatives. Choice, not chance, determines our destiny. Peggy, and I'm going to introduce 4 of wonderful friends and people that I have personally known for years. Peggy Shepard is co-founder and executive director of We Act for Environmental Justice. The organization is recognized nationwide for turning our attention to the urban populations and how best to protect their health and the environment. Peggy tells it always as it really is. I've been there, I've heard her. And we recognize today and every day her unwavering work in bringing all the stakeholders to the table in community-based planning and campaigns addressing environmental protection. She has fostered environmental health policy, big time, both locally and nationally. Peggy and I served on the NYS strategic plan together years back, and you were definitely a voice to reckon with. A lot of your ideas went into that strategic plan. Thank you. We applaud your work as leader, and we are here recognizing that all your work will ensure environmental justice for urban communities, and we know that you will be there for us and keep it in our forefront forever as we move on. The urban populations are very meaningful for all New Yorkers, and we hope that through the children's centers that these urban populations will become a role model, and everybody will look at their urban populations and all the toxic exposures that they face. So thank you very much. Cecil Corbin-Mark is the Deputy Director of WEAC, as well as their Director of Policy Initiatives. Wherever there is a pivotal decision or a meeting taking place, we can always count on Cecil to bring his wisdom and his very strong guidance. Thank you, Cecil. We really do appreciate it. He serves on many boards, among them the West Harlem Development Corporation, Clean and Healthy New York, the Just Green Partnership, the Lewis Burnham Fund, the Center for Environmental Health, and Friends of the Earth. Cecil is a dad. I found out today that he is also a pilot, and he is a friend. He lives in the Hamilton Heights section of West Harlem, a place that I know well. My son lived there for a short time, and I saw Cecil in the street. It was great. It was like, Cecil! And the Harlem Heights area has been in his family for 90 years. Cecil, your strong voice has guided us and will guide us in our future. I thank you very much. Kathy Curtis is the Executive Director of Clean and Healthy New York, an outstanding organization whose mission is to rid us of toxic chemical exposures at every level. Founded in 2006, Kathy and Bobby, who I will also be introducing, took the lead to turn off the tap. I love that. I think I stole that from you, right? It's like onward and upward, turn off the tap, right? I use a lot of your phrases, Kathy. The approach of Clean and Healthy New York has always been creative and inclusive. Very important. That usually doesn't take place. Kathy is the Executive Director of Clean and Healthy New York and brings 30 years of experience to the environmental health movement. Her expertise in politics and policy keeps her busy. We all want Kathy's opinion. Many of the policies that have been acted around the state and the United States have your handprint. Thank you. She co-coordinates the Just Green Partnerships with Cecil and is a member in good standing of the Alliance of Nurses for Healthy Environments. If you need a nurse for immediate assistance, and I have, call Kathy. Congratulations, Kathy, and thank you for your years of service. Bobby Chase Wilding is the Deputy Director of Clean and Healthy New York and brings more than 2 decades of expertise and experience as an environmental health advocate. She leads the Clean and Healthy New York in reducing toxics in child care program, heads up and expanded the Getting Ready for Baby Coalition. That's quite dynamic and hit Long Island big time. Thank you, Kathy. Authored, Bobby, authored and co-authored many guides, including the Get Ready for Baby campaign's Safe Baby Product Guide. Her work takes her across the state, actually across many states. And my personal longtime memory of you is that we're always talking when you and Kathy are in transit somewhere, and you're going in and out of dead zones. But you always answer the call. Thank you very, very much to all the awardees. You much deserve this partnership award. This Children's Environmental Health Network is really important, and we're all going to make it together in the coming years. Thank you very, very much. Yeah, speech time.
Thank you. Aren't these beautiful?
Yeah.
Beautiful. Thank you. So, good morning, everyone.
Morning.
So, Maida said that she was just throwing us a party. And, you know, I really agree with that, because when I walked in and saw so many old friends and new friends that we work with, thank you so much. This is just lovely to have us all convened back together on Children's Environmental Health Day, which is so appropriate. So thank you so much. Thank you to Mount Sinai, Maida and Perry, and all of you, Luce, and all of the workers at Mount Sinai who've helped put this together and have really worked to advance children's environmental health. You know, WEACT is celebrating its 30th year this year, 30 years of struggle and 30 years of achievement. And we're so happy to have been really in the leadership to advance environmental health and children's environmental health here in New York City as well as in the country. Children's environmental health has been a core value and focus of WEACT for Environmental Justice since our beginning. One of the first 5 staff we ever hired was a director of environmental health, and we have had that very strong focus from the very beginning, because we've translated the issues and concerns around environmental exposure as health impacts to community residents. And you know, a lot of people feel, well, you know, low-income folks, people of color, they're not really interested in environmental exposures, environmental issues, and we certainly know that that is not true. From our very beginnings around working around air quality, around the North River Sewage Treatment Plant, and all of the bus depots that are uptown, from those very first days, people began to understand the impact on their health. And again, it wasn't the most affluent people in these communities in West Harlem or Washington Heights or Central Harlem or East Harlem. It has been some of the lowest income folks who really understand in a very visceral way how they cannot control their home environment and the impact it has had negatively on their public health. So we have a very diverse group of people in this community who now understand these issues and are ready to fight and empower themselves and their families for better health around these concerns. And they're taking that leadership. You'll find them down at the City Council when we're talking about, I think 23 lead bills were presented, and some of that lead poisoning coalition, some of those folks are here today. You'll find them going on a bus trip to Albany with Just Green Coalition and Kathy and Bobby to really work on child health protection legislation at the state level. And we're hoping, I think, aren't we hoping, I see you Josh back there, and we're all hoping that we're going to be able to get a Child Safe Products Act, especially with the new Senate, right? Yeah. Right? Okay, fine. And we're going to get that because you're all going to come out and vote and make sure that we flip some of those seats. Well, you know, I just wanted to say that I was on the board of the Children's Environmental Health Network in Washington, D.C. in its early years. And I just want to commend Insay Obo Witherspoon, who's the director of that organization, for helping us all think about honoring children's environmental health action on this day. And she's been such a leader in Washington and the nation around these issues. And so I've been very proud to work with Insay over the years. And again, we have been a co-PI for the last 20 years of the Columbia Children's Environmental Health Center, where our role has been to work to translate research into policy. And you're going to hear from Cecil Corbin-Mark, who's been instrumental in helping that translation, helping to, you know, and contributing to legislation around banning BPA in children's products, banning certain flame retardants, and certainly leading the charge around against toxics in New York State. So I want to ask you to celebrate Cecil Corbin-Mark, and you know, when I ran for assembly, my motto was it would send Peggy to Albany, but we sent Cecil to Albany much too much. So Cecil, please come on up.
Okay. Oh, so we do this part first? Okay. Let me try to figure this out. Okay, you know what? Let's do this here. Thank you. First and foremost, absolutely a huge, big hug to Karen. Thank you so much. That was really sweet and heartfelt, and I felt it in my heart. And thank you to all the other honorees, Mark, obviously Peggy. Peggy is the person who gave me my start in this field, and I'm really grateful to her for that. To Kathy and Bobby, tireless warriors up in Albany and around the country, working on these issues. I'm so grateful for your friendship and your partnership, and especially your dedication to making sure the communities that are often forgotten in these fights are included. So thank you for that. And to Nancy Pavlisco, I hope I did that right. Pavlisco, sorry, I've never met you, but congratulations, and thank you for being a warrior in this fight to protect children's environmental health as well. And then last of my thank yous is to thank the folks at Mount Sinai, Maida, Luz, a former WEAC-er, and all the other folks here, Perry, who's a WEAC member and a tireless supporter of our organization. Thank you all, the team from Mount Sinai, for putting this event together. And for those who work at the Children's Environmental Health Centers, I know many of you, and I'm grateful to you, and it gives me great pleasure whenever we can support the work of the Children's Environmental Health Center, either through policy or through asking for more resources for the incredible work that you do. And then to all of you who are in the audience, thank you all for your tireless dedication to protecting the health of children. When we talk a lot about environmental health and environmentalism, we typically don't think about, we typically think about wide open spaces and pristine beaches. What doesn't usually come to mind are apartment buildings or a city block or playgrounds like the one across from our office on 152nd Street in Amsterdam, bus depots or vacant lots. But that perception only tells part of the story. Those of you who are gathered here know very well that our urban communities are part of the fabric of our environment, and that they are places in which some of the most significant human health and environmental concerns occur, especially those that impact children. And in our built urban environments, none are more vulnerable than our children. And within that group, children of color and low-income white children across the state are even more negatively impacted. It's part of the reason that I care about these issues. As a parent of a child of color, I am deeply connected to that as a result. And in our built environments, children face significant long-term and unique health threats from the environment and from toxics that are in the environment that they live in. We've got to take really comprehensive approaches to providing children with stronger health protection against those threats. Only when we have protected our children, all of our children, can we be sure that we are providing adequate public health protection for all New Yorkers. And while we can mark some milestones of progress, and while we still have a long way to go across the Empire State, while we can mark some milestones of progress, we still have a long way to go across the Empire State, especially in EJ communities and low-income communities across New York. There's still too many asthma deaths among children, and especially those who live in places like East Harlem. Asthma is still one of the leading causes of hospitalization admissions for children, and that has to end. Children exposed to tobacco smoke at home have more days of restricted activity, more days of bed confinement, and they miss more school days each year than other children. Lead poisoning, still the one children's environmental health issue that's completely curable, still affects many children in the city. And that exposure is coming from places like the places where they live, substandard private homes run by criminal landlords, or authorities that falsify reports saying that they're protecting our children from the problem when they fail to do so. Millions of children across the state under the age of 12 live within about 4 miles of a toxic waste dump in New York. Children are more at risk from toxics because their systems are still developing and because they consume more food and fluids relative to their body size than adults. And their unique behavior, crawling on the floor, playing on, as our young friend is doing right now, exposes them to many, many toxics in our environment. We here are gathered in the fight for the protection of children. I thank you for that commitment to making sure, but we still have work left to do. We act as here, working to make sure that the voices of those in urban communities are part of that fight. We're organizing those communities on the front line every day, and we urge you to not only continue your fight, but to listen to their guidance and their direction. They have a lot to say. Whether it's on the fight for building new lead poisoning law, they are the ones that have made a difference in terms of some of the ways in which policies that have broad impact are shaping our world. Or whether it's like on our most recent victory, making sure that those who have respiratory illnesses that are declared by a medical professional can seek assistance from landlords so that they're not just scraping and painting mold, but they're addressing the indoor allergens and hazards that trigger asthma and the underlying conditions that equally create mold. It's their voices and their participation that has helped us shape better laws for this city, better laws for this state, and better laws, I hope, in time for this country. We might have to wait a little bit for that, but we're going to keep fighting anyway, right? So I want to thank all of you. I certainly want to thank Mount Sinai for their efforts in leading this charge. And I certainly commend not only the honorees, but all of you who are sitting in this audience. Continue to fight. The struggle is still going on, and we will join you, and we will fight with you at We Act, and thank you for this award. Yes. Yes, I'm definitely not Kathy, but I love her.
everybody. Wow. We don't expect recognition for the work that we do, so it's so wonderful to get it from such an august body. And so thank you for noticing. And I wanted to thank and acknowledge a number of the people in the room that are the leadership team within the Just Green Partnership, like Laura Weinberg from Great Neck Breast Cancer Coalition, and Josh Weinberg from the League of Conservation. Of course, we have and Karen Miller from Huntington. All of whom, at least, as well. And you know, it's the old proverb: if you want to go fast, go alone. But if you want to go far, go together.
Whoa.
And that's what we do, and that's how we do. So, you know, we're driven to protect kids. That's why we do it, not because of accolades or. The problems are many and varied, and sometimes seem insurmountable. But we've gotten so much done in the last decade or so. Even we look back at the testing when we were doing all of the toy testing and product testing about 10 years ago, in collaboration with React and LTV and others. And wow, we used to find like children's jewelry that was lead. It didn't look it contained lead. It was like 90% lead, and you know, other heavy metals. And then they seemed to switch from lead to cadmium after we were able to get the Consumer Product Safety Improvement Act passed. Like, well, what other junk can we, you know, grab quickly? And so it's not as easy to find those toxicants in children's products anymore. And even though we haven't gotten the Child Safe Products Act passed yet, it certainly has sent a heavy message to the marketplace to cut it out. So that's good news. And we're so thrilled that that children's environmental health in general is really getting the recognition that it deserves and is being held up. Because if we get this right, if we get the first, you know, few years right, then we're in, you know, much better shape. Similarly, if we don't get those first few years right, there's only so much we can do after that. And so those early interventions are important. And we've done a lot of work with the budget in New York State to get the funding, secure and stable funding for the Centers of Excellence. And we're thrilled to be moving into the implementation phase and, you know, being on the advisory council and helping out locally in Albany with that center. Finally, we're implementing. And other, you know, budget items that could contribute to better health for children, like the Interstate Chemicals Clearinghouse and the Pollution Prevention Institute. Those are important as well. And we've gotten a lot done, as folks have noted. The first shot heard around the world on BPA was in Suffolk County, and that was Karen Miller and, you know, and Laura Weinberg and, you know, other groups on the ground got the first restriction on BPA anywhere in Suffolk County, New York. And a lot of states followed, and New York State followed as well.
Big team effort, big team.
Big team. Let's go big team again. Go together. And lots of the chlorinated flame retardants that cause cancer, like chlorinated tris. We've been able to get out of products for the 0 to 3-year-old set. But what we've seen happen is the switch to let's just move the molecule a little bit, and this kind of regrettable substitution that with chemicals that are very structurally similar, but you know, aren't regulated. So they do the same, they have the same health effects. So we're switching to bisphenols, all of them. Organohalogens, all of them. And you know, see what we can move there. Also, disclosure has become a big, important policy initiative. If we could make smarter choices to avoid toxicants, we would. And a lot of times we're frustrated by the fact that they don't have to tell us what's in the things, personal care products, furniture, carpets, cleaners, you name it, that we use, all children's products that we use all day, every day to care for our little ones. So we're working on disclosure. We just got cleaning product ingredient disclosure to be mandated in New York State. So everybody's going to get to find out if there are aspergens, for example, as Cecil noted, in the cleaners we use, so you can not trigger your children's asthma attacks by avoiding them. And we're teaming up toxicants in food, which come to find out is a great pathway of exposure to children. Some chemicals like phthalates and perfluorinated bisphenols. So stay tuned, everybody. And Bobby, that's not all. Oh no, that is not all. Bobby has a bunch of stuff to let us know about, because it's not just government policy. I've never been happier to live in New York State than I am right now, okay? And there's certainly never more of a need for the work that everyone in this room does than there is right now, given the rollbacks on the federal level that Mark noted. So, let's hear from Bobby.
Well, they saved the best for last.
Yes.
I am just really, was really touched to hear from Maida that I was including on this list of such amazing people who've done so much to really fight for children's environmental health. And so thank you so much for the honor of being here. And I am so excited about what's coming with these centers for environmental health for children, because we really need to have this reach across the state. You know, I have friends who are pediatricians in Cobleskill, New York, where I live, and they need those resources as much as urban centers where it's not as far a trip to get to the really intelligent, amazing smart heads who are doing this work. And so when Kathy and I created Clean and Healthy New York in 2006, my daughter was about that age. And it was one of the things that really drove us to embed children's environmental health into our work, was just, you know, daily seeing what the experience of young children are. She's my older daughter. She's now 13 and, you know, almost about to tower over me. But our work has been really held together by, as Kathy said, getting that first 1,000 days, as people are talking about, right, making sure that not only are we making sure that children have appropriate developmental activities, but also really having the environment that's going to give them the best possible start. So in addition to working on policy, it's been my real honor to be able to work in the market arena and to change some of the how manufacturers and retailers are looking at this. So one of the things that we've done since 2012 is train child care providers on how to create safer environments, how to pick the cast iron skillet instead of the nonstick skillet, how to choose flooring that doesn't have phthalates that are going to trigger asthma attacks, how to choose safer cleaning products, and how to do that in ways that are not expensive, because there's almost no child care center on the planet that really has the unlimited budget to make the perfectly pristine space, but there's lots that child care providers can do. And so using the Eco-Healthy Child Care Program that the Children's Environmental Health Network has pushed across the country, we started in the Great Lakes Basin with a grant from the US EPA doing these trainings, and we were actually able to document the results that providers were able to achieve. So they were able to make switches, and we were able to count up the impact and really start tallying the chemicals that we were avoiding, and it's powerful. But really, child care providers, that's not where the change needs to happen, right? The change they don't need to be experts on toxics, they're experts on kids. And so we need those folks who are experts on toxics. We need the companies that are making the products in the first place to be doing better. And so for us, when Karen says we want to turn off the tap on toxics, it's really because that's how we solve so many of the unintended or sometimes just not cared about consequences to children and to our health and to our environment and to our legacy. Because as you recycle your television that has flame retardants in it and it turns into the toothbrush that your child is putting in their mouth, you have this ongoing, enduring exposure to chemicals in ways that people never even think about. So we have a national campaign. As Kathy says, we really believe that going together and going is what is going to take us where we need to go and be together for the long haul. So the Getting Ready for Baby campaign has more than 100 organizations across the country that are working to transform the marketplace so that children's products, as they're designed and made, are made without harmful chemicals. So that regardless of what item you're talking about, whether it's a diaper bag, which people think about as an adult product, the rings on there aren't made with lead in the metal, so babies chewing on those aren't harmed to the car seats, whether getting flame retardants out of them. Just in general, making sure that every person walking into a store to set up the nursery for a new child has access to safe and healthy products. Because it's also not really parents' jobs to become toxicologists and to have test labs to check everything. So we've worked with Bed Bath & Beyond and their subsidiary Bye Bye Baby. As a retailer, we were working with Babies R Us before they went under. And we actually have now merged the work that we did with child cares to really go after the retailers that you've never heard of. Discount School Supply is not rolling off everybody's tongues. But these are the companies that are making the stuff and selling the stuff that goes out to our kids, that are children who are in daycare are using and exposed to every day. And as Karen said, we've got now the Safe Baby Products Guide, and if you're interested, we have some brochures that'll get you to the link over on the table, as well as some additional materials. But we really wanted to empower parents to make those choices, also because it empowers them to become advocates, right? As you understand that there are safer options, you can start saying, hey, we need this to expand to everyone. I tell people that you can't stop me from doing this work. This is something that, whether I have the good fortune to work for Clean and Healthy New York or another organization or not, it's something you couldn't stop me from caring about or working on. And I know that's true for many of you in the room, right? You do this because it's what you love and it's what we need in order to be able to make the change and sustain ourselves and the work beyond times of challenge like what we're facing at the federal level right now. And I'm really excited about what's going to come next here in New York. I feel like there's a great village that's been pulled together here, and I think the opportunities to make transformational change for children's health is really possible, and I'm just excited to be in the room and helping make that happen. So thanks to all of you.
So I'm also known as Luna's mom, and I am so excited and honored to present this last award for our parent champion. Want to tell everybody your name? How old are you? So as you can see, she's the inspiration of the work and what I do at AG. So we've been talking today about how every voice really makes a difference, and there's really no voice more powerful than a parent's voice. And I like the word that Cecil used in his talk, warrior. The parents I talk to every day as a pediatrician are really warriors, fighting for what's best for their children. Yeah. It's your turn? Okay. And in our pediatric environmental health clinic that we recently opened, Nancy Pavlisco and her husband Tom and her really, really cute son Miles were actually our first inaugural patients in our new environmental health center. And what struck us about Nancy was her tireless fight to find the cause of lead in her son's environment, and it really blew us away There's really no limits to what a parent will do for their child, and the steps she took, which she's going to tell us about, benefit not only little Miles, but also a lot of other children. And Maida and I, to this day, are always so amazed of her tireless efforts, and we wanted to recognize her today. And so, with no further ado, I'd like to call Nancy Pavlisco up here. She's been very, very parent
Whew. I'm going to read this so I can get through it, but of course Lauren already has me crying. I've been asked today to share a little bit about our personal journey, but before I do, I just want to acknowledge how incredibly heartening it is to see the amazing people and organizations that are represented here today. I'm incredibly inspired by your work, and I want you to know that you have a new and passionate supporter in me. I'm not standing here today as a parent advocate by choice, but by necessity. In April 2015, I gave birth to a healthy baby boy, Miles. During his first year, he hit all of his developmental milestones at the appropriate times, and I continue to believe that he was perfectly healthy. So at his one-year checkup, when our pediatrician, the amazing Dr. Maya Castillo, said that my son's lead level was 20, I thought it had to be a mistake. I think most of you probably know what that means, but to provide a little context, there shouldn't be any lead in our system, but today's guidelines, 5 is a level of concern. So we checked him again, and again, and again, and it was not a mistake. But what did this mean? I knew lead poisoning was bad. I think most people know that. But beyond that, I really had no idea. So I talked to Dr. Castillo and started doing research. Here's what I learned about how lead poisoning can affect an otherwise healthy child. Developmental delays, speech and language problems, mental retardation, decreased bone and muscle growth, damage to the nervous system, behavioral disorders. It's a daunting list. And the crazy part was, my son looked perfectly healthy. He was a happy, active, growing, expressive 1-year-old. If not for the mandatory screening at his checkup, we would never have known that anything was wrong. I am forever grateful that New York is one of the states with this important policy in place. So once we knew we had a problem, we just had to fix it, right? As Dr. Castillo explained to us, that meant finding the source of the exposure and eliminating it. It seemed easy enough. Here's where it gets interesting. After a very thorough visit from the Department of Health, we learned that there was 0 lead in our home. My son had lead poisoning, but no one could tell us what was causing it. Meanwhile, at this point, Miles's level had crept up to 25. I was terrified, I was frustrated, and worst of all, I felt helpless. But my son needed someone to fight for him, so helplessness was not an option. My husband and I sprang into action. We addressed his diet, we made sure it was rich in all the nutrients that actively combat lead, we made sure his environment was intellectually and physically stimulating to help him stay on a healthy developmental track, and we doubled down on searching for the source. Over the next few months, we left no stone unturned. We had ourselves tested, we had our dog tested. I begged and pleaded the Department of Health to do another inspection of our home and neighborhood. I got proposals from independent testing companies. And I reached out to any place that Miles spent time to confirm that they were lead-free environments. Spoiler alert, to this day, we still don't know exactly what caused his levels to be so elevated. But I know a lot more about what it means to be an advocate for your children, lessons that I believe all parents can really benefit from. First, I learned that it's on you to push government agencies to go above and beyond what they are technically required to do. I demanded that the Department of Health come back to my home. And while they didn't completely solve the mystery, and I probably didn't make any friends over there, their follow-up visit is what led us to the discovery that a painted wooden block that Miles had played with as a baby from a very reputable and popular toy company contained lead. Which means I also learned that lead is allowed in children's toys. This completely blew us away. It's something every parent should know and something every parent should help work to amend. I learned that businesses and facilities that host classes for toddlers and babies including public libraries, are not required to be routinely tested and validate that they are lead-free. This is also crazy to me. This is another area where we can direct our energy and seek change so our children can grow up in a healthy world. I also learned that there are some amazing people out there, from private business owners to city councilmen, who will listen to your story, empathize with your plight, and do the right thing to help protect our children. Some of those people are in this room. I'd like to take a minute to thank Dr. Maida Galvez, I'm gonna cry, Lauren Zajac, and the entire Pediatric Environmental Health Specialty Unit. Words cannot begin to express the gratitude I feel for this team. From the moment they heard about Miles' case, they've monitored his test results, they've provided timely reports, they've thoughtfully and patiently answered my questions and addressed my concerns. They've provided research and articles when we were at a loss for answers, reassurance when we felt defeated, and benchmarks when we needed a progress check. Environmental hazards can be elusive and unpredictable, and most doctors are not adequately trained to deal with them. To know that we had the best experts in the field watching over my son was a tremendous source of comfort on this journey. There's one more thing I can find. If I leave you with anything today, let it be this. As a parent, I made the assumption that everyone was looking out for the best interests of the children in our community. That's not necessarily the case, but there are things we can do to make environmental hazards a problem of the past. Through individual and community efforts, as you have all proven today, we can put policy and practices in place that serve to protect all children and give them the best chance to grow up healthy. Thank you so much for including me in today's ceremony. You should be very proud of the work you're doing here.
It's so wonderful to be in this room with all of you. I personally have learned from each one of you, and I have much more learning to do. And I can't wait to see the work that unfolds in the coming years. And I look forward to really promoting our vision for what a healthy environment is for children across New York State and leading as an example for the rest of the country. So thank you all for being here. We are so glad to be here with you. We want you to hold the date for next year. We want this to become bigger. And we want us to really honor all the champions that exist across the state as examples for the good work that can be done. We want to hear from you how to do this better and bigger next year, and how we can get more youth involved in today's activities. And so if you have ideas about that, please let us know. Dr. Sarah Evans and Lou Squell are in the back, and they're leading the evaluation of our efforts and really helping us to capture the impact of our work. And so please speak to them if you have ideas for how to celebrate next year. And so let's go out and make some noise. Yeah.